social media is still in shock over a 15-year-old renal patient on dialysis at the Cape Coast Teaching Hospital who appealed for support in an interview with Joy News, who we now have confirmed has died. The mother of the young girl, Priscilla Asante, revealed that the daughter passed away early Sunday at 1 a.m. Priscilla is just one of the scores of patients who are unable to access dialysis services owing to the surge in cost of treatment, a situation which has got many Ghanaians on social media calling for an immediate solution. Well, my colleague Richard Kojunyako followed the story. He'll be joining us shortly to share with us details of what's happening to this very young lady as we know it. But beyond that as well, we do know that we're paying attention to the issue a bit more seriously. Well, let's get to Richard Kojunyako first of all, who's joining us via Zoom on this. Richard, if you're with us, the question about the passing of this young girl, do we know exactly what happened? We'll bring you that shortly. For now, our latest spotlight is on Kasim Belkis, who's battling a kidney disease and goes for dialysis 3 times a week. Sometimes, well, she's locked out of the school for being late as a result of going for dialysis at the Upper West Regional Hospital. She's a child of a single parent and depends on the benevolence of family members to raise at least 1,500 cedis for a weekly dialysis. On our dialysis crisis series today, joining us is Rafiq Salam, met her at the dialysis center at the regional hospital and reports that there are only 2 dialysis machines at the center with over a dozen patients.
15-year-old Kasim Belkis, almost a year and a half ago, was diagnosed of kidney disease that requires her to do dialysis.
It started when my BP started rising and I came to the hospital for a checkup. I was diagnosed with a nephrotic syndrome, kidney disease, and I was admitted here and transferred back to the Kolebu Teaching Hospital. And I came back here to start the dialysis just 15th June and 11 days to 5 months today.
Since she started going to the Upper West Regional Hospital for the dialysis on June 15, she has been there 38 times and this session requires at least 450 Ghana cedis for the treatment. The amount of money involved is too colossal for a child of a single parent.
As a single mother I'm born with, she's managing, I'm proud of her, and yeah.
So a week you come here 3 times?
Yeah, sometimes 2, sometimes 3.
So the minimum money paid is 450 Ghana cedis?
Yeah, sometimes the costs take to 1,900, getting to 1,000, so we are just money.
The least amount required in a month to enable her to go for the dialysis treatment at the hospital is 5,400 Ghana cedis. Her grandmother, Amamata Ibrahim, was almost in tears narrating the ordeal they go through to raise the money for the treatment. She has to depend on close family relations to foot the cost of the dialysis for the granddaughter.
I have been supported greatly by my family members. There are others who doesn't have such support. Our plan is even to send her to India for kidney transplant. Dialysis, you cannot afford. How do you pay for the cost of transplants outside?
Transplant. You want to afford the dialysis in about a transplant.
Amamata Ibrahim says the amount involved is staggering and should be reviewed downwards.
15 million. Every week, 15
Every
million.
week, we pay minimum 1,500 Ghana cedis. There are even times that we come for a session which is supposed to be 450 Ghana cedis, but you end up by paying 700 Ghana cedis. But we heard government says they want to increase. 450 Ghana cedis we can't pay. And you want over 700 Ghana cedis? Do you want to kill us? Ever since we started this dialysis, at least 6 persons have so far died because they cannot pay. If I want to say more, I will end up crying. I will appeal to government to include it in the list of medication for the National Health Insurance Scheme.
A view shared by her granddaughter, who wants the cost to be subsidized or made to be free.
Because no one has money. You can't even afford a 3 square meal. So how can you afford dialysis 750 or 350? Some people, they are helping them, so sometimes they can't even afford food to eat. How will they afford the 350? People can't afford the dialysis every 3 days a week. So if they just include it in their health insurance, so you can just bring your health insurance so the government can pay part of the bill and you pay part, it will be helpful to them.
Kasim Reis Belkis just finished junior high school and waiting for her results of the Basic Education Certificate Examination BCE. She recalled the challenges she went through at the school before she completed. She was a perpetual latecomer and many occasions was locked out by the school security personnel at the gate.
And I always feel guilty. Why will I be going to school late? And the watchman, he sometimes he doesn't understand. Sometimes he will lock the gates. Why will you be an exception to come to school late? But by God's grace, I was a 3rd-year student and I was able to write.
The dialysis center here has 3 machines, but only 2 are working. As a result, she has to wake up early on any of the treatment days in order to avoid the long queues here.
It's affecting us. We can't just be in line every day. We can't wake up 4 o'clock to be in line just to be first and go back home to rest. Why? We need more machines and more equipment for this dialysis.
The dialysis center of the Upper West Region Hospital was established in November 2022 through support from Asase Foundation. Medical Director of the Upper West Region Hospital, Dr. Robert Amesia, averred that the fee charge is for the maintenance of the machines.
But for a hospital, what we try to do is not to cash in on patients. The reverse side is, if your input cost is higher than your output cost, then you should just prepare for a shutdown of the center. And we know private centers that started and shut down. We know public centers that started and shut down. The machines use light. Now we are required to pay for light. The machines have to be serviced. You need money to service. The people that service the machines are not in YA, they come from Accra. Everything in life has a lifespan, including human beings. After some period of time, you die. These machines are not going to work forever.
Since the establishment of the center, over 5 dozen patients do come here for dialysis. Kurisa Daniel is the in charge here at the center.
We do have problems with them because you tell them what is due or what is right for them to do, like coming for dialysis 3 times in a week. Some of them default, and because of the default, some of them develop complications at the end of the day. Some are not even able to come twice a week. They come once a week, and once a week, those doing dialysis, they know it's just like you are not doing anything. And it won't take long, then complication will start, and the patient automatically, if nothing is done about it, she dies.
Reporting for Joy News, Rafik Salam. Wow.
Well, Rafiq giving us the very latest now series on the dialysis crisis, but this story is evolving with an angle on illegal mining, because illegal miners should be wary of kidney diseases. That's the warning coming through from the Ghana Kidney Association as it engages stakeholders to make dialysis accessible and affordable to persons with kidney diseases. We can now get more from Erastus Asari-Donko, who's joining us via Zoom on this. Erastus, let's talk about the concerns of this association and why many of us obviously were not looking at the aspect of illegal mining. Why is that coming up strongly?
Well, it has always been there. And I think the association did not even mention, it was giving a warning to illegal miners alone that they should be aware.
Mm-hmm.
I think they should be telling the entire Ghanaian citizenry that we should all be aware. Now, in my upcoming documentary, Poison for Gold, we'll be showing you some people who have been exposed to heavy metals through mercury vapor or vaporized mercury, for example. It's in the system. We have gold smelting joints scattered all across the rural setting in Ghana. And these illegal miners are using gold mercury to create the gold amalgam, and they burn these substances to reveal the gold. All that vaporized mercury is getting into the system. We've spoken with experts who have used mercury analyzers to check the air, contamination in certain areas, which has so far proven positive for mercury. And people are inhaling this within the communities. And we all know the link between some of these heavy metals and kidney problems and other problems as well. We are looking at polluted waters all across our country. We have done some tests. We fetched samples of these and we tested them.
Mm-hmm.
We are seeing arsenic, we are seeing cadmium, we are seeing chromium, we are seeing lead in many of the polluted rivers you see around. And we are also getting expert research into the soil pollution, contamination as well, which people are naive about it, but they are growing food crops and bringing to the markets in Accra and Kumasi and its environs for people to eat.
Really?
So gradually, yes, of course. And so in my upcoming documentary, we'll be giving you evidence of all these. So when you look at it from every angle, illegal mining is coming at us with all these pollutants. Who knows? We have not done extensive research to get to know how these contaminants we see in our polluted rivers are contributing to renal cases that we are having. I think that should be our concern very much, that the government should do a full-scale research into how these are pointing to renal cases that we are having across the country. And I think the Kidney Association people should also be directing research in that area to help change policy, especially as we are joking with the fight against illegal mining.
Right. We'll be hearing from Dr. Thomas Anava shortly, but from your initial interaction with experts, do you get a sense that it might be a contributory factor to kidney disease? I mean, the fact that you have pollutants in some of these water bodies, the farm produce having very high sulfuric levels. What indications are you getting on that?
Well, so on our rounds, the miners, the gold buyers who are smelting these, mercury amalgams, gold amalgams themselves have gotten certain complications. We have spoken with some of them who have as much as 100 micrograms per deciliter of mercury in their blood. We have some of them, people who are not smelting gold, who have a level of high levels of concentrations of heavy metals in their blood just by staying within the communities and, going through the contaminants, polluted waters, and even polluted air as well. And we are gathering all this data and we are seeing the linkages. We are talking to experts who have done works in this area, Pristia and Bogoso, contaminated soils and all that. So it's not something that this time around we're just showing you polluted waters, but we're showing you evidence of a possible linkage between these contaminants and the not kidney cases alone, but other diseases that are coming up in our OPDs.
So we can't wait for that. Of course, it's coming up strongly, and be expecting us as Harry Donko to bring you the very latest on that. Grateful for spending some time with us. But of course, Richard Kojinyanko is also here in studio with us, just to talk about that tragic story of the 15-year-old Priscilla that we lost. Of course, you met her. She was appealing, asking for help just to deal with the high cost of dialysis treatment. And a lot more is coming up later on the Joy News channel, which we will tell you about. Dr. Thomas Anaba is with us. But let's get the story of this lady before we look at the science behind all of this. There was a surge in the cost. Then you found this little girl who says, my parents can't afford.
Yeah, so usually the kidney cases, they start, but you don't even realize or recognize it. So until the triggers, so the triggers come when the doctors will tell you that 2 of the kidneys, they stop functioning. And so that is why you will see some of them, they can't even do anything. So they have to go to various hospitals and medical facilities to test variously for. So one of the last resorts will be to test for kidney. And then once they go, then they test for.
So what we see on the screen now is the young girl, right?
Yes, exactly.
That's the typical process someone would go through.
So on Friday, we went to the Cape Coast Teaching Hospital, just the past Friday.
Right.
So we went to interview her, and nothing showed that she will pass away, even though it's a regular process. So for a whole month, she's been on the dialysis. So after the interview, we came putting the story together, and then we got wind that she passed 1 a.m. on Sunday. In fact, yesterday after airing the story in the morning, in the afternoon, then someone from the Chufu Mampong community gave me a call and said, oh, the young lady you are doing the story about passed on Sunday. I said, wow.
So sad.
Yeah, so just a short time that the lady is just gone.
And her issue is about cost, I believe.
Yeah, exactly. And the issue for her is about cost, and not only for her, but for many of the people that, I mean, we also told you the story of Thomas Vincent Khan, who has been on the dialysis for the past 10 years. In fact, I was involved at the initial stages where we had to even get the public to donate to support. In fact, at that time, I think we got like 70,000. We wanted to get an amount, an appreciable amount that will get him a transplant, but we tried and we couldn't even.
And it didn't work. For those who are just watching us feeling, oh, this is just another health crisis, it will all go away. But they need to know the pain and the challenge for many who are not able to access healthcare when treating, kidney disease. Let's talk about how much is required, for instance, just on the average, to just go on this dialysis treatment.
So let me tell you the story about Priscilla. Priscilla spends 1 month on a dialysis machine. So the mother, who is a farmer, the father is also a farmer. So they have to spend 1,000 Ghana cedis, 1,000 Ghana cedis every week. It is required that you need 3 sessions, but I mean you can
within a week.
Within a week. So we can make do with 2 sessions. And so a session costs them 500 Ghana cedis because being on the dialysis machine will be 350 together with other medication, and sometimes you may also need blood. And so it costs them 1,000 Ghana cedis. So imagine coughing up like 4,000 Ghana cedis in a month and being a daughter of a farmer.
You're not talking about the cost of transport here.
Exactly, because now they have to also travel 100 kilometers to the Cape Coast Teaching Hospital to access that facility. She's not coming alone. She's coming with the mom, and look at the high cost of transport fares and the other. So if you put all of them together in a month, it will cost them like 5,000 Ghana cedis. So you ask yourself, averagely, how many families would be able to afford that? Yes, so when it happens to you and people get wind of that, some will attempt to donate. But for how long will you go to? Like, I come to you, Blessed, give me 1,000 Ghana cedis, I want to go.
And this is a condition you live with for the rest.
And before you get to that stage, then the doctors may have certified that 2 of your kidneys are not functioning. And that is why they are consistently stressing tests. And I've heard a lot of the medical professionals saying that when you get to the age of 40, at least you should test like 3 times in a year, so that so they can see it early. So if 1 is not functioning, yes, you can stay on 1. If 1 is not functioning, then you can have remedies around it, so you'll be able to live, and then they will give you medications for you to be able to.
Okay, what this is bringing up clearly is the fact that, yes, we must admit that we have a national crisis. In fact, later on the Joy News channel, we're bringing you a thought leadership, which will be on this dialysis crisis. And that's why I also want to bring in Dr. Thomas Anaba, who is the Executive Director for the Africa Center for Health Policy Research and Analysis. Dr. Anaba, you've been hearing the harrowing stories. We've lost Priscilla. We don't want to lose anyone else, right? Because even if the equipment is there, people can come in and help, but we don't have the equipment.
Even the renal machines are not that many. So for some of them, because they have to go to the hospital to queue for a very long time, for Thomas like this, he has to wake up around 3 a.m. to go to the facility
and
first.
This is someone who's not healthy already.
Exactly. So it has impact on their health as well.
Wow. Dr. Anaba, how do we fix this? What sort of policies should we be looking at?
Thank you very much for having me, and I would like to appreciate the first person who you interviewed, the journalist, for giving us a very elaborate information about possible causes of renal failures. How do we fix this? First of all, we have to look at the causative factors. And as you heard from the previous presenters, our environment is one of the main causes of the renal failure in Ghana. So if we take Galamsey, I will tell you that most of the people currently in the southern part of Ghana, where mining is going on with renal failures, I can say their cause of renal failure is because of heavy metals in the waters that flow in the rivers, and the waters they drink, in the vegetables they eat, in the fruits they eat, and then the rest. Remember, mercury has been recorded, and other heavy metals have been recorded in our cocoa, and the European Union is warning about mercury in our fish. And even the animals who drink from it, we eat their meats. They all come with heavy metals, and heavy metals will lead to renal failure. So we first of all have to look for the causative factors. Repeated sore throat caused by streptococcus can lead to a renal failure. So many people with sore throat who have been treated it frequently, especially the young children, can end up having a renal failure, and then the rest. Patients with hypertension, we have to look at how we can manage hypertension and stop giving chances to pastors and imams to pray to resolve hypertension. If you don't treat your hypertension, you are causing more pressure on the kidneys and the filters, and the kidney would fail one day and you have problems. Diabetes is a cause of hypertension. These are all diseases that are non-communicable, and that it is lifestyle changes and education that can help us to solve it. But when somebody gets a renal failure, it means the person has a do or die issue. The person must either have dialysis or have a renal transplant or die. This is where I think that government needs to come in to support these people, because the cost of doing dialysis and the income levels of Ghanaians is not commensurate to each other. You can't just do it unless you are fortunate to be in a family that is rich, or that is very connected, or that has benevolent people elsewhere in their associations to help you, or else you can't have it done. So I think that there must be a measure whereby government will say, look, every dialysis, I want patients to pay this, the rest I will take care of it. I think that should be the best solution. First, educate the people about the hazard, the dangers, make sure we eliminate the risk factors, and then those who get it, we help them subsidize the treatment. It is not like malaria that you can either take Coartem or Lonart or any other anti-malaria and get it resolved. No, it is something that you must get the dialysis done. Getting the renal transplant in Ghana is not something easy, virtually impossible unless you travel out of Ghana. And even if you come back, the cost of it is not easy. I tell you, the renal patients don't only go there for the dialysis. Like they said, they buy medications for their hemoglobin. Some of them buy erythropoietin. Every week they have to inject it, which is costing about 300 cedis. They have to buy cardiovascular drugs, antihypertensive drugs. They have to buy, some of them are diabetic, they have to buy diabetes drugs. They have to modify their diet. And you know how expensive it is to modify diet in Ghana. So this is where I think that government needs to come out with a policy on how to help reduce the risk factors and also support those who fall into this ailment or fall foul of this and get ill, so that at least their families will be relieved. No one should say it's very expensive, so at the end they will die. No, as it was said by one of my heroes, Fidel Castro, the health of one person in his country was far valuable than the whole wealth of the entire world. So it doesn't matter how much we spend treating people with dialysis to save their lives. It is how we can keep people alive when they are sick. And I think dialysis is one of the things that government should give priority to. At least taxes should be taken off, like people have called, and it should be part of NHIA. And at least, if government even want the people to contribute, it should be some basic amount that they should contribute, so that at least they will have an extended lifespan to have a sigh of relief. Because the families, I've known families who have sold houses just because of dialysis. And we think that government needs to step in this time.
Dr. Anaba, if you can hear me, I was just, pointing to the fact that you've managed a public hospital before, because you've managed the Greater Accra Regional Hospital before. You know that the cost is simply unbearable for government. Government can't just take off the cost as you're recommending. So how do we, find a nice balance between getting government intervention and also dealing with the cost component?
Please, no one can tell me it is unbearable for governments. We have money in this country. The fact is that we do not prioritize. And I can just give you some few examples. $70 million invested in digging a hole to build a church. Do you know how many people with dialysis, with renal failures can get dialysis? For 2 good years, 12,000 people, 3 sessions a week, can get renal dialysis for 2 good years. Do you know how much we spent in fumigating for COVID-19, which was a useless venture? 91 million. Do you know how many people can get dialysis with this money? A whole lot of people. It is how we invest. Do you know how much we spend in renting accommodation for COVID patients that was never used, an accommodation? 15 million Ghana cedis and 12 million Ghana cedis at advance. And no single person lied in that house in Adaku. Please, we are wasting resources on useless ventures. We don't prioritize, or else this is not too much for government. After all, it is our taxes. If you use it to save anybody's life, the same people will work to pay the tax. So to me, saying that it is too much a burden on government. Do you know how much it costs to finance the stay of Ken Oporeata's daughter in the US? $52,000 a year. What course is he doing? Undergraduate course. And you think we don't have money?
Okay.
So please, I think it is misplaced priority that Ghana is facing. I am speaking from a standpoint of applying our resources, our meager income judiciously. Because if I want to go on and count on ventures that have been taking place, that has investment that we have done, that has gone wasted, $2 million in investing in tight frame, that never came. How did we use to help the renal dialysis patients?
Okay.
So please, meet improperly.
Right. Dr. Naba, just hold on for me because Richard is still here. Richard, what more issues did you see, as part of the challenge that many of these renal patients were facing when, of course, you were carrying out the story with Priscilla?
Like I told you, so people for the Cape Coast Teaching Hospital, for example, people from the Western region, people from some parts of the Ashanti region, people from various parts of the country, they come. So, and this is a renal unit that does not have a lot of the machines, so people would have to even struggle, even with money, they have to even be struggling to even be on a dialysis machine. And apart from that, just as Dr. Naba has intimated, the cost. So it keeps people. So
is it that this is a piece of equipment we can't buy, like an individual can't buy?
Well, and that is why he's pointing to us that we can actually buy
it. Okay.
Yeah, exactly. But so if you look at what the medical professionals who work at the renal unit will tell you, that some families get dejected and then they come. Because see, you are torn between saving the life of your relative, your son, your daughter, your father, your mother, and then also looking at costing, the amount of money you spend on the dialysis. So, for instance, you want your daughter to live, but how much can you afford to ensure that your daughter survives or something. So it's really, you are torn in a critical position. Just that if you are my brother and you are a patient of a kidney patient, so I don't want to lose my brother. But then again, I need to also look for money to ensure that my brother survives.
So this is the Cape Coast Teaching Hospital, right? So serving, say, the central region, I believe. Let's look at the disparities in the procurement or perhaps the circulation of these machinery across our health facilities. So we are looking at central region, looking at the facility that you went to. How many of these dialysis equipment did you find, or officially were you told that, okay, this is what's functioning? Okay,
so I think there were about 3 of them.
So 3 serving everyone who comes there?
Exactly. So in times past, it was even burdensome for them. I don't know whether the Western region has now got some machine, because the last time I was speaking with them, they told me that a lot of the cases were coming from the Western region and perhaps pointing to the illegal mining craze that we are all concerned about. But now it looks as if that part also has. Just like the Upper West region now has a dialysis machine, a functional renal unit that people would have to go on. But a lot of them relate to the cost and where they will be traveling from. So if you are in Cape Coast, maybe you can just pick a taxi and then go. But if you find yourself beyond Kakum National Park, Chufu Mampon, Chufu Praso, and sometimes from
additional
cost traveling from, and the person is not really well. And when it happens like that, you need to measure what you eat. So I listened to someone who said that initially he weighed 80 kg. But because of the restrictions and don't eat this and don't eat that, now he weighs barely 50 kilograms. It's just like the 50 kg. Yes, exactly. So you see, the water that you take is measured. If you take beyond that quantity,
what happens?
You feel a lot of discomfort in your body. And that is why you need to go to the hospital for all of these toxic substances to be drained out of you. So that is the work the kidney machine or the renal machine does. So it performs the work. Otherwise, the kidneys would have performed in your body. But now the kidneys are not functioning. So if you take in things that will be burdensome for the kidneys, then it means that you need to go to the hospital for it to be drained. So others, accurately, there should be 3 sessions. But now they have seen
people can't even do the 3.
So they do 2. But you see, the danger in doing 1 or 2, it compounds the situation.
Because you're not getting treated.
Exactly. But some have been able to stay. But I have met 12-year-olds, 15-year-olds. So you cannot really point to the fact that, it relates to this particular age group. The children are now getting it, the elderly 40, even 50, 60 people. So gone were the days where people had problems, but they didn't really test for kidney failures.
All right. Richard Kojenyaku, thank you for joining us with that. And Dr. Anaba, let me take your thoughts on the point is just built for us about the disproportionate level at which we have some of the regions having a higher concentration of the renal machines or the dialysis equipment, and the remote areas, for instance, in the north where you are, some of the facilities don't even have one.
I think besides the Tamale Teaching Hospital and the Wa Regional Hospital, there's no any other hospital in the north that has it. I know of some private hospitals that are working hard to get it established. The problem is that if you establish it as a private person and you are not able to manage it well, to collapse and the investment will go away. This is where I think we will need a work of national security to assess some of this data and say, look, we are losing people just because of dialysis. What can we do to minimize the loss of life just because of renal dialysis? No, we don't see those things. So I think once they know that the northern sector is the most poorest part of Ghana and that the very poor people come from that area, definitely anybody with a renal failure would have a challenge in paying for the dialysis. This is where government needs to come in. At least all regional hospitals, at least people who need dialysis. Because private sector, if you establish and they can't pay, it means your investment has gone to nothing. So this is where government needs to come in.
I see.
You see, for the data we have, out of the people who get coronary renal failure up north here, less than 10% of them are able to do dialysis for 3 months. And less than 1% is able to do dialysis for 1 year. So if you have 100 people who have chronic renal failure up north here, then 90 of them will die within 3 months. That is what it means.
Yeah.
And this is where national security, the government, research to see what support they can give, because it's not all of them who get the renal failure who cannot be saved. Let me tell you, pregnant women who develop eclampsia, some of them go and end up in renal failure, acute renal failure. And if you are able to do dialysis for 1 week, 2 weeks, 3 weeks, you get your kidney back. But if you are not able to raise the money, it means those unfortunate women will die just because they don't have money. It is true. They don't have money. What is the income levels here? Very, very low. So it's very sad. And I think we need serious government intervention.
All right. Doc, I'll take your thoughts on one last issue, but that will be after we do this. The issue about, the use of herbal medicine and, how we can have, for instance, the FDA clamp down on the use of unapproved medication. It's a key issue that we need to look at. But I also need to inform our listeners that in a few minutes from now, we'll be having that extensive conversation on this, because later at 5 p.m., Joy News will be having that national convention on the national dialysis crisis and the way forward to changing the situation. So head of the health desk here at Joy News, Fred Smith, is joining us with details of what we're to expect. We know this will not just be on the Joy News channel, this will be on Joy 99.7 FM and all of our other platforms. But why is it necessary that we have this conversation at this time?
Well, it presents a unique opportunity for us to find a solution to this. Of all those we've had who need treatment at the renal unit, majority of them can't afford. Those who could afford have now become poorer because they were spending all their resources on this. And within a few months or maybe a year or two, you run out of money and it becomes very difficult for you to afford dialysis treatment. And therefore, all you have to do, we had Dr. Adaba say, die, unless you get the money. And if you don't have the money, it's only one thing happening to you.
At the end of the conversation, what are we seeking to achieve?
Well, we're seeking to drive change, seeking to find a solution to the crisis that we find ourselves in. We will have government representatives here. The presidential advisor on health is going to be around, so we'd like to hear from them. What is government going to do? Government is the one who keeps all our money. What can government do to bring relief to those who need this dialysis treatment? We'll also have the National Health Insurance Scheme. There was a suggestion by the WHO recently that, yes, we could use the National Health Insurance Scheme to address this gap. We will explore that as well, but it will also require money. So we'll find out how we're going to be able to do that. And ultimately, we'd like to hear from the experts who will speak on what individually we can do so we stay away from kidney problems in the first place, so we don't have to end up in a hospital.
So it's a mix of issues, having the solutions on the dialysis problem and also trying to promote healthy living. But just as we wrap up, the point about who can be a part of this conversation and how the general public can also feed into the conversation that we'll be having. Are we making room for that?
Yes, we are all at risk. So each and every one of us must pay attention to what's going on today. It starts at 5 p.m. and we expect that whoever you are, wherever you are, you will find a way to join us either on radio or on TV. We will have a live stream as well on our website, majoronline.com, and also on all the social media platforms, Facebook, Twitter, now X, and the others.
Indeed. And it's just about 40 minutes away, so you want to stay with us here on the Joy News channel. Dr. Anaba, we're all looking forward to that thought leadership. But let's start off by promoting healthy living. The reliance on herbal medicine is being pointed out as one of the key causative factors. Also, the point about unlicensed and registered or unauthorized medication. It's all part of the challenge. So medication for kidney disease treatment. What should the public know about this?
For kidney disease treatment, medications are really difficult, very difficult, because if the nephrons are destroyed, the only alternative you have is to get a filter, external filter, like the dialysis machine, to do the work for you. What we need to do for preventively is to make sure that all herbal medicines that are sold in Ghana are properly licensed and clearly explained what treatment they can be used for. Sometimes you check with the Food and Drugs Board, and as they go for a certificate for a supplement, you end up seeing some of them on some TV stations, you're hearing them from radio stations as treatment for certain diseases. Let me tell the general public, most of the herbal medicines they sell around are considered by FDA as supplements, and supplements are not medications. Let's beware of that. And some of them will go for one license, and at the end they sell thousands of medications, or sell one medication for thousands of ailments, which may not be true. Besides that, the villages, you go inwards, inside the villages, and you see people carrying things that the ground, the boils, and they are just selling it, and people, for lack of resources to go to hospital, unfortunately, fall victim of some of these things. And these things can really cause problems. I have seen some of them. I have seen patients with serious liver failure, serious renal issues, just because they went in to drink some concoctions to cure typhoid. They went in to drink some concoctions to cure some sore throat. So it is true that serious research needs to be done, and there should be serious control mechanism established by FDA and the national security to clamp down on illegal herbal medicines that are circulating in the market. However, they say so that we minimize are not good. You go to the US, there are herbal medications, we call it the Wanda tree, and people go there, they are supplements, they call them supplements. But here we call them medication. That is where the mistake is. Unless it is really proven to have any efficacy and safety to treat a particular disease, no one should take any of these medicine, supplements as a medication. And FDA needs to come out clearly educating the public on the drugs that they are licensed, and also go to the market and do some surveys to clamp down on those who are cheating people, making people fall prey of their ignorance and getting renal diseases and hepatic diseases. It goes alongside with liver failure. Most at times, they go alongside with liver failure, which is very dangerous.
Okay. Dr. Thomas Anaba, thank you for spending time with us on the Joy News channel. And of course, in just about 40 minutes, we'll be having that thought leadership put together by the Joy News team, where we'll have responses on all the concerns you might have about this kidney disease condition, and also the national dialysis crisis as we have it. Reps from the presidency, the presidential advisor on health, will be here, also part of the dialogue, and we'll be hearing from NHIS as well as part of the concerns on social protection. So all of that will be coming up here in the next half hour. You want to stay with us here on the Joy News channel. You're still watching the polls. When we get back, we'll tell you more about the stories that we have for you. Please stay.